Good evening, colleagues in Europe. Good afternoon, colleagues in America, and good early morning, colleagues in Asia. This is the finale of our study-a-thon. It's a season finale because, as you will see, we are not finishing here. But it's been a very intensive 4 days, and we are delighted to bring to all of you what we've been doing and what we've discovered and learned. Next slide, please. So, for those of you who have never been in touch, who have never heard of Odyssey, Odyssey is an open science community, and this is our mission statement: to improve health by empowering our community to collaboratively generate the evidence that promotes better health decisions and better care. Next slide, please. These days, we should have been together as a community, learning from each other and sharing experiences in the beautiful city of Oxford, where I'm based, to hold the Odyssey Europe Symposium. We had more than 200 people registered, a very large number of sponsors, and outstanding abstracts and science to present. But something like 3-4 weeks ago, we made the sad decision that we had to contribute to flatten the curve of this coronavirus outbreak that's spreading, and we decided to cancel the meeting. Next slide, please. Instead, we decided to organize a Odyssey COVID-19 study-a-thon. Of course, it's a virtual study-a-thon, and it's the first time we're doing an activity like this, but we definitely didn't want to spend those 4 days at home and not doing anything useful for the community. So we thought we could use that time to do something productive instead. Next slide. This is what the world looked like when we joined for the first time this study-a-thon only 4 days ago. More than 526,000 infections and almost 24,000 deaths. Only 4 days later, you can see what this looks like now. Almost 200,000 infectees more and 10,000 deaths. That's almost 50,000 infections per day and almost 2,500 deaths a day in the world. Our feelings and our hearts and our minds are with all the people who are suffering this disease, all the people who are taking care of them, and especially as a clinician, I must say I am really honored and really proud of the work that my colleagues are doing in the front line, putting their lives at risk to take care of those people who are in real needs of healthcare at this very bad time. Next slide, please. So we had a very ambitious plan 4 days ago. We wanted to do a number of studies to see whether we could contribute to better characterize the coronavirus infection that's going on around the world. We also wanted to learn whether we can predict who is gonna need specific care in the context of a coronavirus infection. And we also wanted to look at the effect of some of the medicines that are being trialed or used indeed for the treatment of this disease. It's a very ambitious plan that we had in mind, and I'm going to leave you with Patrick to tell you what progress we've made to date.
Thanks, Danny. We started with this ambition of trying to conduct a series of studies that, as Danny reminded us, would likely be the kind of thing we would lay out as a 4-year plan, and we decided to try to make it a 4-day target. The question is, now 4 days later, how much progress have we made? I'm extraordinarily proud to highlight and be able to demonstrate the incredible progress that has been made throughout our communities in just 4 short days. Our characterization studies that were just an idea 88 hours ago have now been designed with a thorough literature review to understand the current state of knowledge of COVID-19. We've worked together to think critically about how to develop and evaluate phenotype definitions to represent confirmed and suspected cases of COVID-19, as well as to create reference benchmarks from prior viral seasons examining influenza, including back to the last pandemic in 2009-10 with the H1N1. We took those phenotype designs and have developed study packages that are now completed and available for execution. And not only that, sites across the data network have run those studies, and you're going to get to see the first collection of results that have come in from sites who have been able to take these open source analytics packages, run them, and contribute back results to the open community. It's actively ongoing across the characterization group that we are now looking at those results to see what insights we can gain. Not only is this primary analysis that's critical to us making great headway, but already the team has set its sights on conducting specific subgroup analyses of interest, with particular interest in a pediatric population. We've also fully fully designed and implemented study packages to examine influenza, and we've received results back, and we're in progress executing results across our data network. So it's amazing to see what's possible with some research questions about characterization and how much progress we were able to make in just 88 hours. And you're going to get to hear more about what we've done in characterization in just a few moments. On the prediction front, we started with an idea just 88 hours ago, an idea that flattening the curve requires making difficult decisions about how to triage in a situation where health resources are in short supply. And we identified 3 potential prediction questions that were useful. Those ideas 4 days ago have turned into literature reviews to understand how people have previously tried to predict viral outcomes. We've designed and evaluated phenotypes to represent the target populations at risk and the outcomes that we want to study. We've developed open source standardized analytics to develop predation level predictions by applying machine learning algorithms across the Odyssey network. And we've had multiple sites across the network train new models and externally validate models that have been developed. So in just 4 short days, we've gone from the idea of whether or not it's possible to predict to now being able to show you predictions and models that we have that we think directly can contribute to our current understanding of the current crisis. And so I'm excited to have Jenna and Ross and Anik to be able to share those results with you. On the estimation front, we started 4 days ago with an idea and a series of priorities that we heard from our colleagues at the EMA and the FDA and the CDC, that there was a lot of questions about uncertainty about products that are currently being considered for prophylaxis or treatment of COVID-19, as well as questions about the interaction between COVID-19 and ACE inhibitors. What started from a huge public health demand has now progressed to the point that we've conducted a systematic literature review to understand what was previously known. We've designed and evaluated phenotypes to represent those populations. We've designed an analytical plan to conduct proper causal inference on those questions. We've developed a study package that has been disseminated across the data network, and results are coming in from sites around the world. You're going to get to see some of the preliminary results. We're going to focus particularly on the fact that our examination of hydroxychloroquine, we have probably the best results that exist to date in examining the safety of that product, and Danny's going to be able to highlight that. You'll also going to be able to hear from Albert and Daniel about some of the other studies that are on their way and have been fully prepared over the course of this short few days. So how did we do this? In 88 short hours, we went from a bunch of ideas to a bunch of tangible products. Well, for those of you who've been following along at home, you've seen the progress of what's happened on our website at odyssey.org/COVID-19 updates. And you could have followed along by watching the videos, and many of you as collaborators have been participating alongside the community to do this work. So what did we actually do in the last 88 hours? Well, we convened 351 researchers from 30 countries into one virtual environment with a one common goal: to do whatever we could to learn from observational data to generate reliable evidence that could inform health decisions and better care. To do that, we've held 12 global huddles. This would be our last in that series. But in addition to these meetings that we have held every 8 hours for the last 4 days, there have been over 100 collaborator calls where groups of individuals have said, let's meet up and talk and engage in the science that is necessary. And in our collaboration platform, there's been over 13,000 chat messages of these collaborators interacting with each other to try to advance this common cause. In the last 88 hours, we've had 15 concurrent channels going on, talking about the studies that we want to design and the the studies and the competencies necessary for us to design, implement, and execute these studies. You're going to hear in just a second from Jenny that our literature review group reviewed 10,000 publications in the last week, and trying to synthesize all of that evidence so that when we produce real-world evidence, we can properly ground it in what's already been known to understand where we can make a contribution to public health. In the last 88 hours, we have drafted 9 protocols, which are now available and formed the foundation for all of our analysis plans that we then designed to and are executing and will now show results. Those 9 protocols resulted in 13 study packages. These are open source software code that anybody can download now and run to execute a study. Those study packages include studies that the data network has executed themselves to share back results, as well as the incredibly important work that we've done that Daniel will highlight for you with ACE inhibitors, where we spent the time to design the appropriate design, recognizing that the data that we need for that question is likely still to come in the coming weeks and months. Collaboratively as a community, we actually designed 355 cohort definitions and did a thorough development and a validation of over 100 of those cohort definitions, and they are now in use in our study packages. And Anna's going to be able to highlight for you what lessons learned in that process. And together in 88 hours, we've assembled a distributed data network of 37 data partners who've signed on to execute studies, generate results, and share for this global open community call. So in 88 hours, I think what we've demonstrated is what's the power of a community and what can happen if we all come together to focus on the public good and to deliver the evidence that's necessary for society. But all of these numbers are fine and good. I think what's really important is what have we actually learned to advance science? And what I'll tell you is that in the last 4 days together, I think we've done 3 things that no one else in the world has ever done. We've conducted the first large-scale characterization study of COVID-19 in patients in the US and Asia. And Ed's going to highlight the results to show you how we've expanded upon some of the preliminary literature that was focused on some of the early experiences in hospitals in China to now examine what's been going on in Korea, as well as some early readouts from US electronic health records in the United States. This is the first international study systematically examining COVID, and it's also the first study that, to our knowledge, that thoroughly did a longitudinal analysis to be able to look at baseline characteristics, including demographics, medication history, and prior conditions. And so really excited to have Ed share with you those results. In the last 4 days, we also developed and evaluated the first prediction model that's ever been externally validated on COVID-19 patients to support the triage to flatten the curve. We've developed models by using an influenza model to use the data from the last decade and to train models that we can then apply to the relatively sparse data of the COVID experiences that we're seeing around the world today. But as you're going to see from Jenna and Ross and Anik, we've actually been able to see tremendous progress in producing very promising models that really seem like they can provide an objective basis for thinking about how to ration healthcare resources. And encouragingly, what we can learn from the past experiences of patients with the flu seems to suggest that we might actually be able to project that knowledge into what's currently happening with COVID-19, which we're excited about. And last but certainly not least, together in the last 4 days, we have conducted the largest study ever on the safety of hydroxychloroquine. This is the drug that is most actively being considered in some parts of the world for the prophylaxis and treatment of COVID-19. And it's critically important that we actually understand the safety profile of this medicine. And yet, for many reasons, this drug has been relatively understudied in recent and contemporary international data. And so Dan is going to walk you through how we have designed a study, implemented an appropriate best practice design, generated results across our data network, and can make some pretty conclusive statements about what we understand about the safety profile that we can add to the current medical understanding. These are 3 things that we together as a community did in the last 88 hours that nobody ever had done before. And I would submit nobody could have done without the collaborative effort that we just put in together. So I want to take a moment to just congratulate everybody on this amazing accomplishment. Now, that's not all, though. We aren't going to rest on our laurels of having 3 major accomplishments. There's also 3 things that we're about to do that nobody has ever done before. What you're going to hear about today is that we've designed a self-controlled case series analysis to examine the safety of IL-6 and JAK inhibitors. These are products for rheumatoid arthritis that have been considered as potential treatments due to their immunosuppressive behaviors. And we think we've got a study that is going to provide some light, shed some light onto the safety of these programs. That package is actively running as we speak, and we should have results very, very soon. You're going to hear about progress we made towards designing and implementing an international study to evaluate protease inhibitors. These are drugs indicated for HIV and hepatitis C, and are actively being considered because of their antiviral properties as a potential treatment for COVID-19. And Albert's going to highlight for you how the team has thought rigorously about the appropriate study design considerations to compare protease inhibitors versus alternative antivirals for HIV and Hep C, and how we now have a study in the works to actually critically evaluate whether or not we can draw valid causal inferences that could provide some valuable insights about the safety of these products. And then last but not least of what's on the horizon, Daniel Morales is going to share for you the tremendous progress we made in designing and implementing a study to evaluate the impact of ACE inhibitors against COVID-19. As many of you know, COVID-19 has a response to the ACE2 pathway, and so there's a lot of speculative discussion going on about whether or not ACE inhibitors may potentially increase hazards for patients. But there's pretty precious little data beyond biologic plausibility. And so what Daniel and the team have done is designed a study applying best practice epidemiologic and informatics and statistical thinking to prepare a study package that is now ready to execute as soon as we have ample COVID-19 data with patients, subpopulation with patients exposed to ACE inhibitors, so that the moment we have the data, we're going to be able to generate reliable evidence. These are 3 things that we are about to do that have come out of this last 88 hours that nobody has ever done before, and I would submit nobody could have done without the collaborative spirit of what we've brought together in Odyssey. So again, I want to congratulate everybody on what is truly, truly an amazing accomplishment, and thank you for all of your hard work to make what was a series of ideas only 88 hours ago now a reality with real science that can contribute to this current pandemic. So, ground rules for this presentation. We'd like to take you through the journey that we've been on for the last 88 hours. And what we'd like to do is to share with you what's happened for each of these studies. We're doing this because I think it's important for us to celebrate the tremendous progress that we as a community have made towards advancing our scientific understanding of COVID-19 and generating knowledge that can hopefully help policymakers, providers, and patients make better decisions. As we go through this, we want to also highlight the rigorous analytical methods and scientific best practices that we've brought to bear on these questions. While it's tremendously impressive how fast we've been able to work, what shouldn't be lost is that this is all done with the utmost importance of generating high quality science. And so you're going to hear about how we've imposed scientific standards to make sure that the work we're doing satisfies our own standards of what's necessary. And through the course of these presentations, we're going to share with you the preliminary results. Now, it's been 88 hours. These results are hot off the presses, some of them literally just minutes ago. So we're sharing them with you, not for the expectation that you'll overinterpret and think that we've got the final answer to any question, but rather so that you understand the journey that we've been on to generate this evidence, to provide you a view of where we are today, and to provide a very clear view of where we're going on the journey ahead. So take these preliminary results to hopefully gain the same level of excitement that all of us have of the progress that we've made, and hopefully to motivate our continued collaboration as we continue to advance this journey to generate high quality evidence.